Welcome to the discussion of clinical cases from our school. In this video, we will present a patient with craniofacial system dysfunctions and how this affects their posture. In the clinical case discussion sessions, we show patients with different situations of craniofacial dysfunctions that affect the postural tonic system, as we will see in the case under discussion today. In general, muscle chains are understood as a set of muscles that work synergically. This synergy develops through the fascia. In an ascending or descending way, through the muscular fascias, alterations and compensations of the static posture occur. This synergy is regulated by the postural tonic system responsible for developing muscle tone, thus creating a closed cybernetic system that regulates the static posture of the organism. It is very important in the diagnosis to study the situation of the craniofacial system to see how it affects the posture of the body. This is what we will see by analyzing the patient in our clinical case, where a dysfunctional alteration of the craniofacial system alters the posture of the organism. We can observe in profile patient who presents a marked loss of vertical dimension in a subject with a divergent type of conformation, where the negative forces of the craniofacial system are even greater. We will proceed to analyze the local situation, as well as the posture of the patient under study. From the postural point of view, the divergence of the postural planes is evident, which makes us suspect two alterations, one high and the other low, are generating the pathology. At the oral level, you can see an anterior mandibular position that has caused defensive bruxism to create a good anterior guide. They generate a lot of hyperactivity at the cranial cervical level, blocking sutures and altering cranial sacral breathing, as well as generating neuromuscular dysfunctions that will affect the neck mainly and then the rest of the posture. In these photos, we can see the abrasion caused by bruxism in the attempt to create an anterior guide with a corresponding functional area. In the frontal radiograph, the lateral mandibular deviation with the intrusion of the right condyle is evidently seen, as well as the inclination of the occlusal plane. In the lateral X-ray, we observe the biotype that corresponds to a hypodivergent or brachycephalic subject. This type of individual has a low vertical dimension, and in the case in which it decreases even more due to defensive bruxism, this increases muscle strength tremendously. Here we see the initial posturometric layout where there is no overload of the body with the mouth open and the eyes open, which indicates that the posture is in a harmonious situation. In the second tracing, carried out with the mouth closed and eyes open, the influence of the mouth is notably seen. The body posture increases from overload when the patient closes the mouth, which demonstrates that the dysfunctional craniofacial system is affecting the static posture of the organism. In conclusion, we can reach the following result. Therefore, a holistic and interdisciplinary approach and treatment is necessary, where all health sciences speak the same language to be able to intervene in the same way. We must know how dysfunction of the craniofacial system affects body posture. Without this knowledge, we will not be able to carry out efficient and lasting physical rehabilitation. The body is indivisible and we cannot diagnose and treat it sectorally. Therefore, a holistic and interdisciplinary approach and treatment is necessary, where all health sciences speak the same language to be able to intervene in the same way. I hope you found this video useful. If you liked it, give it a like. If you like the channel, subscribe, click on the bell and you will receive all the information about what we are doing at all times. See you in the next video in our channel. Follow us on our social media and on our pages. And for any information, write to the emails found in the description. See you in the next broadcast, and thank you very much for your participation.